Hello and welcome to another edition of Healthy Living here on Times. My name is Tabby Kamangala and this program is sponsored by Mazim.
You have all your Mazim information in one place. With the Mazim mobile app, all Mazim members register on the Mazim mobile app. Download the app from Apple Store or Google Play Store. Install and open. Click register to register. Enter your membership number. The default membership number has 9 digits. If you don't succeed, try 11 digits. Choose your name, password, and OTP destination. Remember, when adding your mobile number, 265, not plus 265. You can also register with your email address easily and keep updated with your Mazim account right in the palm of your hand. For more information, email infodesk@mazim.mw or visit www.mazim.mw.
Now, last week we had pointed out that we're going to have a two-part series, or rather a two-part interview of healthy living with John Kuyokwa, a psychologist. And last week we were dealing with anxiety. Now, this is the second part of that two-part series where we'll be talking about substance abuse, which is an issue that we felt here on Healthy Living affects a lot of people and that more people need to know about that. So again, I am joined today by John Kuyokwa. He is a psychologist, and today we're going to be talking about substance abuse. Maybe for those who missed the anxiety program, just explain to us again what mental health is.
So mental health, as I said, mental health, there are several definitions.
Yeah.
But a definition that almost encompasses a lot of things is when you have the ability to cope with day-to-day life and live as holistic as possible as a human being. Yes.
Now, in this two-part series, we've been talking about examples of the mental health issues that you're talking about right now.
Yes.
Last week we spoke about anxiety, and this week we're talking about substance abuse.
Yes.
What is substance abuse?
Okay, substance abuse is when you use a substance, like a drug or a medicine, or any illegal substance, in a way that is able to damage your ability of day-to-day life. Yes.
You pointed out illegal.
Yes.
So none of them are legal substances.
Yeah, there are some substances that are not illegal.
Okay.
For example, if you are taking diazepam, pethidine, I think you might not have heard about these drugs. Pethidine is one of the strong painkillers. So when you get it, it makes you relax. Yeah. So maybe you might have, because you were involved maybe in a road traffic accident, you were in very big pain. So the doctor or the nurse gave you that drug. So now, because you were given that drug, and you now feel like you are missing that experience of being calm because of that drug.
Yeah.
So what happens to you is that you start buying that drug and you start now using that drug. So it's an abuse. But that drug is not illegal drug.
Right.
Yes.
Right.
But now we have another illegal drug. For example, cannabis in our context. It's not allowed. We all know that you are not allowed to smoke cannabis. So when you're using that one, it's an illegal drug. Yes.
Right. Now, how does this come about? You, an individual rather, starting to abuse substances. How does that come about?
There are several situations, but basically, sometimes just testing. Yeah, you hear about cannabis, you hear about this drug, it does this. So you test, and then you have that experience. Okay, yeah, it seems it's good. Then you go back and test it, and then you go back, and then you can't do without. Then you start to abuse.
Yeah.
So sometimes that's what happens.
Yeah. What is that caused by?
But basically, they are very similar. Like I was talking about the anxiety, environmental factors. Environmental factors, for example, family. You have a parent or a family relation who abuses drugs. So you are likely also to abuse. Remember the role model issue. Yeah, if my father, my mom does this, that means it's good. So that's the way people do things.
So you've seen somebody do it, and
Yes.
you now start having an idea of this is the way to live life.
Yes.
So you are not aware whether it's wrong or bad.
Yeah.
As long as this individual does it, you
Yeah.
also start.
Yeah.
Uh-huh.
And sometimes peers within the context of the environment. Yeah.
Yeah.
You, for example, you're in the university or in school. You see, those people who they seem to enjoy life. And then you're also moved into that system.
Yeah.
And you feel like when you're doing that, you're enjoying life in the university. So you can start using abusing substance because of the environment. Sometimes it could be also genetic. There's that genetic predisposition. So research reveal that when you have parents who have been using substance, as a child you're also likely to use a substance. There's that association.
You are most likely going to
use the substance. But it's not equal to. I have to make it clear here.
Yeah.
If your mother, your father uses substance, it's not equal to that you also use.
Yeah.
But you are likely based on what has been found. Yes.
Now,
So,
in terms of at what point
Yes.
does it get to be called abuse? Because, for example,
Yes.
alcohol,
Yes.
right? In some countries, when you're 21,
Yes.
from the age of 21, you're allowed to drink.
Yes.
I think in Malawi it's 18.
Yes.
You can drink alcohol.
Yes.
At what point do you then say this is now abuse?
It's when it starts to control your day-to-day activities.
Okay.
So you can take alcohol, for example, 2 bottles, and you're able to make judgments clearly, and you know what you are doing, and everything is okay.
Yeah.
That is not an abuse. Because we should make it clear.
Yeah.
Yes.
Yeah.
But when you start to use the same alcohol, to the level that you can't make a proper judgment, that you do in day-to-day activities, that is an abuse. And then even you find that you can't do without. So there is little money that you have planned to use as a family. You go to get that little money and you buy those drugs or that alcohol so that you can feel good at the expense of the others. That means you are in a state of abusing. You have even financial problems because of the same abuse.
So are you saying that the aim of using these substances is to make yourself feel good
Yes.
from something that happened?
Yeah, for example, you are coping with a stressful life event. You might have lost maybe a relation, a friend, or maybe lost a job.
Yeah.
It is not something that is pleasing to lose a job, isn't it? Or all of a sudden you've lost a job, and then you are feeling to cope to be someone who stays at home without a job. So how do? You want to remove this unpleasant feeling. So you use these drugs so that you also feel like, things are working. But in reality, things are not.
Yeah.
Yes.
At what point is bad? At what point can we say that this person is abusing? And what are the signs and symptoms? How can I tell that, listen, I've now started abusing substances, or I see a family member? How can I tell that this is now abusing a substance?
It's, for example, your personal lifestyle. Your personal lifestyle might change. For example, you used to be someone who is kempt, someone who's well-dressed, well-bathed, and everything is okay. Now you are abusing substance. The self-care goes. Number 2, financial issues. You find that now you are busy having lots of loans because you are taking that money to buy the drugs so that you feel good. And even, aggression. You can be very aggressive. Towards very small issues, very irritable and aggressive because you are using substance. And sometimes you can also know that this person is using substance because even at work, they can't perform as expected. So those are some of the common signs that you can easily know. That this one, no, something is wrong.
So those are the signs. The signs.
There are some of them because the list goes on.
Right.
Yes.
When we come back, we're going to talk about treatment and cure of substance abuse. So we'll be back with more healthy living after this.
Life is an up and down journey where anything can happen at any time. But at any time, you have peace of mind with Mazim. Mazim offers all-inclusive affordable medical aid cover in various packages of schemes in line with your budget, with a promise to take care of you and your family in that time of dire need. From giving you access to medical services at hospitals locally and abroad, emergency evacuation, dentist, and optical care, all the way to funeral benefits. MASM is there holding your hand, keeping you covered. For details of the medical scheme you need, call 01-820-298, 01-820-543, 0888-707-100, fax 01-820-217, email infodesk@masm.mw, or visit www.masm.mw. MASM, your ultimate healthcare solution.
Welcome back. Remember, this is Healthy Living here on Times. We had a two-part series. The first part, we spoke about anxiety, and today we're talking about substance abuse with John Kuyoko. We've been talking a lot about what substance abuse is and the signs and symptoms.
Yes.
Let's dive into the treatment and the cure. Now, once I realize that I'm abusing substances, or a family member is abusing substances, what do I do?
Okay, so basically, you as a person, as a family member, as a friend, you have a very big role to help this friend or this family member. Because if you have identified, that's the first part of management.
Yeah.
That we have a problem. That's the first part. So you take them to the nearest, in this context of health system, you take them to the nearest health center. The way we were talking about anxiety?
Yeah.
Yes, you take them to the nearest health center. So when they go there, the clinicians, the nurses will be able to identify that you are abusing substance or not. Remember, we talked about the use and abuse.
Abuse.
Yes. So those nurses and clinicians will know that no, he's using or she's using and not abusing. So depending on the level, if you are in the context now abusing, so what will happen is that the nurse or the clinician will know, okay, if this one is abusing, who is the right person to meet? So they will refer you to the nearest health center where there's someone who is trained in mental health. So we've got clinicians trained in mental health. We have got nurses trained in mental health. Yeah, and even institutions that provide mental health care, like St. John of God in Lilongwe and in Zuzu, and even Zomba Mental here in South. So there will be people who are specialized on how to help someone to move out of a substance. Even in our general hospitals, there are people there who are specialized to help someone at a primary level.
Speaking of that, I read somewhere that in other countries they have rehabilitation spaces.
Yes.
Where when you abuse substances, you can go there and stay there for a number of weeks or months.
Yes.
And then by the time you come out, then you're now, they call it clean.
Yes.
Do we have that in now?
For public, no. But for private, yes.
Okay.
Yes, public, St. John of God
Okay.
does some rehabilitation. So you go there, usually they book. So you have to book, like you have a client who needs services, so they'll put on the list, and then you can go and get the rehabilitation. So they've got counselors there.
Right.
And then, all services are available. But it's private.
But it's private.
Yes.
Do you think that substance abuse issues in our country are taken seriously and that people are aware of them?
No. Of course, recently, the media has been commenting. We've been listening, people talking about it, social media. But as in broader context, common man, that has not been shared as expected. We have a problem. We've seen young people, even studies are revealing that young people are using lots of substance. But in terms of awareness to different sectors, I think we still have a job to do.
What can we do better?
Of course, one of the things that we are doing, you are asking me on how best we can do. It's a first step. Because I've been privileged to come here and share. So many people will be able to listen to what happens and how best, or what are the strategies, what are the protocols to get help. Yeah. So this is one of the things. The other thing is us who are in the industry of psychology, mental health, medicine, nursing, to teach our people about substance use, that it is real and that they have to seek care. So it is everybody's responsibility. Me as a guardian, me as a friend, I have a responsibility. If I see someone having this problem of substance abuse, I should be able to go and help him out or take him to a relevant place.
Yeah.
Yes.
Now, as we close the chapter about two series in
Yes.
terms of, a two-part series rather, in
Yes.
terms of anxiety and substance abuse,
Yes.
as a whole, in mental health,
Yes.
there's been an increase in the suicide rate.
Yes.
There's been a very high increase, which is a negative development.
Yes.
Is substance abuse related to that?
Yes. Even so, one of the complications of substance abuse is suicide. When using substance, when you're abusing them, you are likely to also to go through suicide attempt, even completing the suicide. So there's that correlation. Yeah, there's been association. It's good that you recognize that there have been these numbers increasing. However, we are doing not that much on suicide management and prevention. There are steps, different forums. We're able to see people are coming out on how to help out. But maybe that would be a topic of another day, suicide management, prevention, and how do we go about it. But the only challenging thing that we have as a country is that our constitution on issues of mental health, specifically suicide, we have a challenge. So why am I saying that? The constitution or the law provides that when you attempt suicide, that's is it a criminal or whatever case against the state? So you are supposed to be taken to prison.
You, the person who tried to commit suicide.
Yes.
You're supposed to be taken to
Into
prison.
But here, you and me, we are agreeing. I would want to believe that we are agreeing that suicide attempt is a mental health challenge.
Yeah.
So now you have someone who has a mental health challenge being taken to prison.
Prison.
You understand?
Yeah.
So to some extent, within our systems, we need to rework such kind of provisions. Yeah. To say no, suicide attempt is a sign of mental health challenge.
Yeah.
So if being a mental health challenge someone has to get help. So what happens? These are just suppositions. So you might have suicidal thoughts because you are going through depression or depressive episode. So now you attempt suicide, and you know, because I've attempted suicide, I'm going to be incarcerated, whether at Chichiri or Zomba Maximum Prison. So what do? It's better I finish because you go through misery.
Yeah.
Yeah. So to some extent, if we can, as government or as relevant stakeholders, we can move on to change that penal code or discuss how best we can do these things. Maybe that would help even to reduce suicide. I'm coming in on issues of suicide because you had asked that association.
Yeah. Which I think is a very important message to share, especially here on such platforms.
Yeah.
Speaking of that, we will now move on to our fitness segment.
when the stars collide, and by your side, I'm gonna be there. Baby, we don't need to run away. Forever we are gonna stay. When you call me, I'll be on my way. When miracles.
And that's all the time that we had for you. Remember, this was a two-part series with John Kyokwa, a psychologist. We spoke about mental health issues, in particular, two examples of mental health issues, which are anxiety and substance abuse. Last week, we tackled anxiety, and this week, in today's program, we tackled substance abuse. Now, remember, if you live close to, or if you feel like you have anxiety or you're having substance abuse issues, best to go to your nearest hospital, and as John Kyokwa had suggested, go to the health center and get some help from there. And also, counseling does help, so you might want to look into that. Otherwise, my name is Tabby Kamangala. This was Healthy Living here on Times, and remember, this program is sponsored by Massive.
Life is an up and down journey where anything can happen at any time. But at any time, you have peace of mind with Mazim. Mazim offers all-inclusive affordable medical aid cover in various packages of schemes in line with your budget, with a promise to take care of you and your family in that time of dire need. From giving you access to medical services at hospitals locally and abroad, emergency evacuation, dentist and optical care, all the way to funeral benefits. Mazim is there holding your hand, keeping you covered. For details of the medical scheme you need, call 01-820-298, 01-820-543, 0888-707-100, fax 01-820-217, email infodesk@mazim.mw, or visit www.mazim.mw. Mazim, your ultimate healthcare solution.